Today, I want to talk to you about performing CPR outside the hospital setting. Everyone should know how to perform CPR. It is a skill that should be memorized and learned very well because you can never tell when you may be called upon to use it. According to a report by the American Heart Association, cardiac arrest remains a public crisis. There are more than 356,000 out-of-hospital cardiac arrests annually in the U.S., nearly 90% of them fatal. Early initiation of CPR will increase the likelihood of survival. The location of out-of-hospital cardiac arrest most often occurs in homes and residences to about 73.9%. This is followed by public settings, including places of employment, to about 15.1%. And lastly, nursing homes account for about 10.9%. If performed immediately, CPR can double or triple the chance of survival from an out-of-hospital cardiac arrest. Now let's begin with a scenario. A 55-year-old man walking in front of you in the street suddenly grabbed his chest and collapsed. What would you do? Well, the first thing I would do is to stoop over him and ask him if he's okay. If he verbally responded and has a pulse, then the next thing I would do is to call 911 and wait with him until they arrive. However, if you ask him how he feels and there is no response and there is no pulse, then ask someone to activate 911, and the next thing you would do is to begin high-quality CPR. High-quality CPR is described as 100 to 120 compressions per minute with a depth of 2 inches. After each compression, allow the chest to completely recoil. In the event that rescue breaths are needed, the ratio is 30 compressions to 2 breaths. If rescue breaths have to be given, please make sure that you have the mouthpiece, which would prevent direct mouth-to-mouth contact. The 30 compressions to 2 breaths is for adults only, regardless of it being 1 rescuer or 2 rescuers. Remember, the order is circulation, airway, and breathing. High-quality CPR is definitely required to restore circulation. According to Canadian Red Cross blog, over 2 million lives have been saved 1 year using CPR techniques. So it does work. Well, thanks for watching. Please don't forget to like, share, and subscribe. I wish you well. Good night.